Okay, so friends, whenever patients come to me, apart from using psychopharmacological approach, apart from writing medicines, prescribing medicines, they also ask me what else we can do. So I generally ask them to improve their mental health by using tools to improve mental health. So now, what we will be discussing in this slide will be the tools to improve mental health. What is stress? What is stress response? What is response to extremely stressful situation? ICD-10 criteria for diagnosis of PTSD, causes and symptoms of PTSD, management of PTSD, what is emotional freedom technique and its efficacy in PTSD, uh, especially focusing on the scientific evidence. So when patients come to me, they ask what else we can do. So I generally ask them following things to improve their mental health and well-being. One is I ask them to do stress management. Then they should regulate their feelings and emotions. I help them develop skills for good interpersonal relationships. That means how to win friends and influence people. I then ask them to pray and to connect with the higher spirit, higher power. So my training in past life regression therapy as well as reincarnation has helped me to understand that we are mind, body, and conscious continuum. So spiritual growth actually helps at the level of uh, consciousness. Then I ask them to have good physical health and to consume healthy, nutritious diet. And then I obviously keep stress on how to have good, refreshing night sleep, and then learning and attending workshops on self-help skills. So now coming on to see, friends, if we have to understand PTSD, we need to understand stress management. So, okay. Uh, what is stress? So, this is the state of worry or mental tension while one is trying to cope up with a threatening situation or threatening people or threatening circumstances. So, what is the stress response in the body? The stress response refers to the physiological and psychological reaction which happens in one's body as a result of stress. You may have heard of fight, flight, and freeze response. So, Dr. Ranjan, whenever we are facing any stressful situation, then our body reacts in a way which is called as fight, flight, and freeze response. So, what happens and what is the response to extremely stressful situation? So whenever we are facing any extreme stressful situation, then obviously the level of stress is at the peak. Therefore, we can feel the symptoms of autonomic nervous system hyperarousal. That means one will feel panic, hyperarousal, palpitation, restlessness, feeling of suffocation, feeling of choking, sweating, dizziness. These are the symptoms we often feel in panic attack as well. Most of the people who go through traumatic events may have temporary difficulty adjusting and coping, but with time and good self-care, they usually get better. If the symptoms get worse, last or if they last for months or even years and interfere with their day-to-day functioning, then patients might have PTSD, post-traumatic stress disorder. So what is the ICD-10 criteria of the PTSD? Let me make it simple. So ICD-10 criteria of PTSD. Post-traumatic stress disorder is a mental health condition which arises as a delayed or protected response to a stressful event or situation, which can be of brief which can be either brief in nature or of long duration. And the stressful situation should be exceptionally threatening or catastrophic in nature, which is likely to cause pervasive distress in almost everyone, in anyone. So, friends, we have usually four criteria of PTSD. One is that patient must have faced exceptionally threatening or catastrophic event. Second is, after facing the event, he is terrified and he is having symptoms such as intrusive memories. That means repetitive recalls and reliving of the trauma. That means flashbacks or nightmares or emotional numbness, including detachment from other people, unresponsive to the surrounding, anhedonia, etc. Such people usually avoid the activities or situation which may remind them of trauma. And obviously, they have a state of autonomic hyperarousal with hypervigilance, enhanced startle reaction, or insomnia. And anxiety and depression are commonly associated with these symptoms. So simplified criteria, again, I am telling you that there must be four things in PTSD. One is exposure to exceptionally stressful event. Second is intrusive memories of the events. Third is avoidance of the circumstances which resemble the stressors. And fourth is hyperarousal, such as hypervigilance or startle response, or inability to fall asleep or staying asleep, anger outburst or irritability or inability to concentrate. So friends, PTSD is an accelerating mental health challenge worldwide. People who have undergone extreme catastrophic reactions like wars, man-made catastrophic situations, or natural calamities, these are the people who may have post-traumatic stress disorder. So it is an accelerating mental health challenge worldwide with all these wars going on, the war between Russia and Ukraine, and then there is a war between Israel and now it is in the with the Arabian country. So all these kinds of war actually may lead to PTSD. An estimated 30% of those returning from combat zone will develop PTSD. 6.8% of Americans are likely to suffer from PTSD in their lifetime. And they may have sexual or other interpersonal violence, accounting for nearly two-thirds of such cases. What is happening in Indian population? So one study conducted by NIMHANS Bengaluru shows that the percentage of adult population with PTSD diagnosis in past 5 years was 0.22%. PTSD were more common in females. Most patients had interpersonal traumas. That means trauma arising out of the bad interpersonal relationship, especially sexual abuse. The median age of the onset was 22 years. All the patients had re-experienced symptoms with an equally high level of avoidance and arousal symptoms. 82% of those patients had comorbid psychiatric disorders such as mood disorders, for example, depressive disorder and anxiety disorder. And males had a higher rate of comorbid substance use disorder and depression, and females had higher rate of comorbid dissociative disorders. So what are the causes and symptoms of PTSD? PTSD may develop, post-traumatic stress disorder may develop after an injury or assault or an incident like shooting incident or natural disaster with the sudden death of the loved one or witnessing the death or serious injury of the another. The often debilitating symptoms of PTSD include flashbacks, nightmares, intrusive thoughts, severe anxiety, hypervigilance, sleep disturbance, and poor concentration. These symptoms are associated with deterioration in personal, social, and financial domain of life. Management of PTSD. Both psychological and pharmacological interventions are available to treat PTSD. Dr. Ranjan, when I see such kind of patients, obviously I prescribe pharmacological treatment, but then I try to help them by helping them improve their mental health. So cognitive and exposure therapies have been demonstrably effective, with a review of early studies concluding that the current literature reveals robust evidence for cognitive behavior therapy, which is safe and effective intervention for both acute and chronic PTSD. However, the study which I am quoting here, the authors caution that non-response to CBT by post-traumatic stress disorder can be as high as 50%. So in our clinical practice, I have realized that patients are, and even the therapists are not well trained to conduct cognitive behavior therapy, especially trauma-focused cognitive behavior therapy. So what are the challenges to the treatment of such patients? While pharmacological treatment like specific selective serotonin reuptake inhibitors like fluoxetine or sertraline or escitalopram, they do reduce symptoms. But however, the relapse is common upon the cessation of treatment. Clinical guidelines typically recommend that the first line treatment should be the trauma-focused therapies. However, trauma may also be stored as a bodily memory. So we all have seen that whenever we have faced a stressful situation, then it might lead to having chest pain or difficulty in the chest region. That means people may have palpitation. So each trauma may lead to some bodily disturbances or physiological symptoms as well, which may be stored as bodily memory, suggesting that treatment should utilize the bodily intervention. That means the intervention should not only be at the level of cognition or at psychological level, but it should be at physical level as well. Somatic approaches can target not only muscles and fascias, but also the neurological correlates of trauma. That means if we add somatic approaches, then patient will be able to get rid of both the psychological component of stress as well as the physiological component of stress. The focus of this analysis is clinical emotional freedom technique, which is a therapeutic modality which incorporates cognitive and somatic elements. So luckily, the therapy which we are employing in our patient, it contains the elements of both healing the trauma at cognitive level as well as healing the trauma at the body level. So what is emotional freedom technique? Emotional freedom technique is also known as tapping technique, and it is a self-help management technique. EFT may help calm you if you are feeling angry, or it may help ease your thoughts if you are worried about something. It involves tapping on specific acupressure points while focusing on the emotional or physical issues. So which acupressure points we have to tap? This is the side of the hand. We have to tap like this on this point, and then another is top of the head, center of the head, and then another acupressure point is on the inner eyebrow here, then outer eye here, then below the eye here, then below nose, tapping here, and then you have to tap below lip, and then you have to tap below the collarbone and underneath the armpit. So these are the acupressure points which are present on the face and the torso where we have to tap while doing EFT. So proponents of the EFT, and I am also the proponent of EFT, they claim that it can help to reduce stress, anxiety, pain, and varieties of the negative emotions. Since 2013, I am regularly employing EFT in my patients, in my family members, in my friends, and on myself. And I have seen the results. And yes, it helps to reduce stress, anxiety, pain, and variety of other negative emotions. So the probable mechanism of action of EFT. So how EFT works? So EFT employs uh, the techniques from cognitive behavior therapy and prolonged exposure therapy. These both techniques have been described as the best techniques to deal with the post-traumatic stress disorder. Prolonged exposure therapy is also a kind of cognitive behavior therapy with the name of trauma-focused cognitive behavior therapy. So during an EFT session, one will focus on specific issues of distress while tapping on the specific acupressure points on one's face and the upper body. So proponents of EFT believe that tapping on these points help to restore balances in the body's energy system, which can lead to emotional and physical healing. This is the reason. This is the reason body's energy system, that why it has not been accepted by mainstream psychiatrists, because uh, most of the Western traditions do not accept, and there is no scientific, they tell that there is no scientific evidence that the body has energy systems, whereas most of the Eastern traditions such as acupressure, acupuncture, yoga, naturopathy, it believes in body's energy system, right? So this is the reason that why the mainstream scientists are unable to accept the relevance of EFT. So EFT also incorporates the techniques from CBT, such as the awareness building. That means when patient comes to us and he is diagnosed as a case of post-traumatic stress disorder, so our first aim will be to help the patient understand what PTSD is. That means to psychoeducate him about the signs and symptoms of post-traumatic stress disorder. Secondly, we also incorporate imagined exposure in our EFT. That means we ask to remember, revisit, recall the entire incidents while tapping on the acupressure points. So we ask them to remember and recall most currently distressing traumatic memory. And we ask them to provide a detailed, vivid verbal account of the traumatic memory, which may include vivid sensory information. That means how the patient had suffocation, how the patient had feeling of palpitation, how he was feeling nervous, what kind of thoughts he was having, what kind of feelings he was having, what was the reaction in the body. So he has to explain all this. That means we are using this technique of imagined exposure in the EFT. And then we ask the patient to cognitively reframe the entire incidents. That means he should reframe the entire incidents. So it is a kind of psychological technique which consists of identifying and then changing the way situations, experiences, events, ideas, or emotions are viewed. So the way he is viewing the whole situation, we ask the patient to reframe it, so that in order to that he releases the associated negative feelings and emotions. So this is how a patient gets systematically desensitized. Systematic desensitization means initially he will be desensitized of less sensitive memories, less provoking memories, and then gradually he will be exposed to more severe memories, and then those will also be desensitized. So prolonged exposure or trauma focused cognitive behavior therapy is a kind of psychotherapy. It is one specific type of CBT, and prolonged exposure teaches you to gradually approach trauma related memories, feelings, and situations that you have been avoiding since your trauma. So it is the most scientific established treatment for PTSD among a variety of the pharmacotherapy and psychotherapies. And we are happy to tell you that we are incorporating these principles in emotional freedom technique. So can EFT be used to manage post-traumatic stress disorder? What is the scientific evidence? Numerous randomized control trials and outcome studies, as well as meta-analysis, have demonstrated that clinical EFT is effective evidence-based treatment for PTSD. So I have taken this from a latest study which was published in the Health Psychology uh, article. So it was a systematic review. An extensive body of research examining clinical EFT for PTSD has accumulated. The population represented in the research include war veterans, victims of sexual violence, spouse of PTSD sufferers, motor accident survivors, prisoners, hospital patients, adolescents, and survivors of natural and human caused disasters. So I've taken it from the study of Sebastian and Nelbs 2017 and Feinstein 2022. So what are the advantages of EFT as shown in the research? In the 7 studies reported in the existing meta-analysis of PTSD of EFT on PTSD by Sebastian and Nelbs 2017, the mean dropout rate, that means defined as those who withdraw from the study or were lost to follow-up, was less than 10% of the participants. That means EFT is well accepted by the participants, whereas dropout rate from cognitive behavior therapy is more. EFT has also been included in conventional intervention programs such as the Warrior Combat Stress Reset programs at Fort Hood, the largest US military base using EFT and EMDR for remediation of the post-traumatic stress disorder. Additional advantages of EFT as seen in the scientific research. So the 2019 practice guidelines for clinical treatment of complex trauma in Australia updated its recommendation to include EFT, noting that the method is nationally and internationally endorsed. So more and more countries are now adopting, more and more the psychologists are from various countries are adopting this emotional freedom technique. The National Institute for Health and Care Excellence, NICE in the United Kingdom, has created a new category for treating post-traumatic stress disorder, and they have termed combined somatic and cognitive therapies. Whereas prolonged exposure and cognitive behavior therapies are working only at the mind. So NICE guidelines have created a new category with combined somatic and cognitive therapies, which is comprised of emotional freedom technique and thought field therapy, which is the precursor of EFT. NICE evaluation identified preliminary evidence for this category and indicated it is now one of the 4 research priority areas. So friends, Dr. Ranjan, hello, Dr.
Yes, sir.
Ranjan.
Yes, sir.
So up till now, I have talked about the scientific aspect of post-traumatic stress disorder and how what scientific research says about EFT. So this was more of a kind of a PowerPoint presentation, and I know I heard somewhere that PowerPoint presentation are the presentation without power. So I myself was not comfortable while delivering this PowerPoint presentation because I was not able to connect with the audience. Now I would like to connect with the audience. So Dr. Ranjan, जो हम कर रहे हैं
हाँ,
तो वो मैं आपके साथ शेयर करना चाहता हूँ.
ठीक है, जरूर.
हाँ, so every day what we do is कि I have devoted time from the early morning part. That means when our OPD starts at 8 o'clock. So from 8 o'clock till 9 o'clock, 1 hour slot is there to help a patient with the psychotherapist. So every day I make a calendar. So I have made a calendar. So every day uh, I give appointment to one person for psychotherapy, and then he is given a repeat. Uh, After his session, he is given repeat appointment, maybe after a period of 10 days or 15 days, right? So when patient come to me with various problems, like he is having maybe anxiety disorder, or he is having depressive disorder, or he may be having stress related disorder, or maybe post traumatic stress disorder, then I teach them mainly emotional freedom technique, and I often pass on this brochure to them, so where I help them read along with me. So we start from here that EFT is a stress reduction technique. So I tell them to read along with me. And then I tell them that it's a brief novel intervention which combines elements of exposure and cognitive behavior therapy and somatic stimulation. So my patients usually do not understand these terms. So I help them understand कि ये एक ऐसी technique है. So I talk to them in my own cultural language. So I talk to them either in Hindi or Punjabi, and I tell them कि ये एक simple technique है. ये cognitive behavior therapy और somatic stimulation को मिलाकर बनाई गई है. इसको साइकोलॉजिकल एक्यूपंक्चर भी बोलते हैं. जैसे एक्यूपंक्चर में हम निडल्स यूज करते हैं, यहाँ पर हम टैपिंग टेक्निक में 2 फिंगर से टैप करते हैं. So मैं ये भी बताता हूँ कि EFT is researched in more than 10 countries by more than 60 investigators, and its results have been published in more than 20 different peer-reviewed journals. So Australian research has found EFT for obesity, food craving, smoking to be extremely successful and durable over time. Efficacy is also established for phobias, post-traumatic stress disorder, anxiety, depression and pain. तो मैं इसका एग्जांपल लेके अपने पेशेंट को समझाता हूँ. So मैं बताता हूँ कि tapping is very effective for reducing anxiety and stress and other emotional issues, and it works both on the real and imagined stressor. चाहे आपको genuine stress है, genuine external stress है, या फिर आपका imagined stress है, दोनों में ही EFT work करेगा. EFT significantly increases positive emotions and self-esteem and resilience. So EFT आपकी mental health को improve करती है और decreases negative emotional states, और negative emotional state को reduce करती है. It appears to affect the amygdala, which is the stress center in the brain. Actually, the amygdala gets very sensitive, specifically in the cases of post-traumatic stress disorder, and it is the stress center in the brain. Also, hippocampus gets affected, which is the memory center, and they both play a role in the decision process when you decide if something is a threat or not. तो जो लोग एक्सट्रीमली स्ट्रेसफुल ट्रॉमेटिक सिचुएशन से गुजरे होते हैं, उन्हें सिंपल से सिचुएशन भी टेरराइज करती है. सिंपल सा क्यू जो उन्हें अपनी पुराना ट्रॉमा याद दिलाता है, उससे भी उनको एंजाइटी होने लगती है. तो मेन रीजन होता है कि उनका अमिगडाला और हिप्पोकैम्पस ये सेंसिटिव हो चुका होता है. EFT has also been shown to lower cortisol levels, which is a stress hormone. Because EFT affects by reducing stress, तो ये हमारे स्ट्रेस हॉर्मोन्स को भी रिड्यूस करती है. और स्ट्रेस हार्मोन अगर बढ़े हुए हैं, जैसे कॉर्टिसोल अगर बढ़ा हुआ है, तो इट कैन लोअर इम्यून फंक्शन एंड अल्टीमेटली इट अफेक्ट्स अवर फिजिकल हेल्थ. दैट मींस वी फॉल सिक ऑफन. तो मैं बोलता हूँ कि जब एग्जामिनेशन टाइम होता है तो बच्चे ज्यादा उनको फीवर ज्यादा होता है, उनको अपर रेस्पिरेटरी वायरल इन्फेक्शन ज्यादा होने लग जाती है, क्योंकि उनका इम्यून सिस्टम लोअर्ड हो जाता है. देन आई टेल देम कि ये EFT करते कैसे हैं. तो आई एम ऑल्सो टेलिंग यू कि ये 5 स्टेप प्रोसेस है, बहुत इजी है. सबसे पहले आपने अपना इश्यू आइडेंटिफाई करना होता है जो कि आपको स्ट्रेस दे रहा है. इट कैन बी अ फीलिंग, इट कैन बी अ थॉट, इट कैन बी अ बिलीफ, और इट कैन बी एनी फिजिकल सेंसेशन. दैट मीन्स अगर आपको हेडेक है और वो भी आपको परेशान कर रहा है, या फिर आपको पास्ट का कोई ट्रॉमेटिक मेमोरी परेशान कर रही है, तो आप उसको आइडेंटिफाई करें. स्टेप 2 का में rate your level of distress out of 10. That means how much you are affected by that particular event out of a scale, on a scale of 0 to 10. That means 0 means no stress and 10 means maximum stress. So step 3, state your problem out loud. स्टेप 3 में हम एक सेटअप स्टेटमेंट बनाते हैं जिसके 2 पार्ट होते हैं। पहले पार्ट में पेशेंट ने बोलना होता है कि मुझे इस चीज का स्ट्रेस हो रहा है। लेट अस से कि उसने कोई कार एक्सीडेंट विटनेस किया है और उसके बाद उसे हार्ट के एरिया में पाल्पिटेशन है। तो वो स्टेटमेंट ऐसे बनाएगा कि जो मैंने कार एक्सीडेंट देखा उसमें मुझे एकदम से शॉक लगा और मेरे हार्ट के एरिया में रेस्टलेसनेस हो गई, एंजाइटी हो गई या पैनिक हो गया। तो वो पहला पार्ट ऑफ स्टेटमेंट है। सेकंड पार्ट में वो बोलेगा कि डिस्पाइट दिस आई एम विलिंग टू रिलैक्स माई सेल्फ, या आई एम विलिंग टू एक्सेप्ट माई सेल्फ, या आई एम विलिंग टू ओवरकम माई एंजाइटी। मतलब वो जो उसको उस मोमेंट में सूट कर रहा होगा, जो उसको नेचुरली अच्छा लगेगा, वो सेकंड पार्ट में बोलेगा। तो 2 पार्ट्स हैं इसमें। टैपिंग करते हुए बोलना है कि हालांकि मुझे उस मोमेंट में बहुत स्ट्रेस हो गया था जब मैंने कार एक्सीडेंट देखा, तो मुझे बहुत धड़कन हो गई थी, घबराहट हो गई थी, बेचैनी हो गई थी और मुझे बहुत डर लगा था। फिर भी आज मैं अपने आप को इस स्ट्रेस से रिलीज करने की कोशिश कर रहा हूं। तो ये पार्ट सेटअप स्टेटमेंट बनेगा उसका, और उसे ये सेटअप स्टेटमेंट 3 बार बोलना है क्लासिकल क्लिनिकल ईएफटी के हिसाब से। सो स्टेप नंबर 4, टैप विद द 2 फिंगर्स ऑन द पॉइंट्स ऑफ हेड एंड योर चेस्ट एरिया। तो आपको चाहे आप टॉप ऑफ द हेड से स्टार्ट कर लें, चाहे आप आईब्रो पॉइंट से स्टार्ट कर लें, और आपने पॉइंट्स बोलने हैं शॉर्ट रिमाइंडर फेस कि वो जो कार एक्सीडेंट से होने वाला स्ट्रेस, कार एक्सीडेंट से होने वाला स्ट्रेस, कार एक्सीडेंट से होने वाला स्ट्रेस, या कार एक्सीडेंट से होने वाला जो कार एक्सीडेंट से जो मेरे अंदर डर बैठ गया है, वो फियर जो कार एक्सीडेंट में बैठ गया है, वो फियर जो कार एक्सीडेंट में बैठ गया है, वो फियर जो कार एक्सीडेंट में बैठ गया है, वो फियर जो कार एक्सीडेंट में बैठ गया है, वो फियर जो कार एक्सीडेंट में बैठ गया है, वो फियर जो कार एक्सीडेंट में बैठ गया है। इसको रीफ्रेज करके बोलना होता है। इसको जब रियल लाइफ एक्सपीरियंस में, मतलब रियल लाइव एक्सपीरियंस में बोलना होता है, तो वो थोड़ा सा इसको चेंज करके बोल सकता है। वो जो मेरे डर मेरे दिल में बैठ गया है, वो ऐसे बोल सकता है, वो जो डर मेरे दिल में बैठ गया है। सो दिस इज स्टेप 4, एंड इन स्टेप 5 he has to take a deep breath, and while after taking deep breath he has to reassess the level of distress present in the body। क्योंकि ये माइंड के लेवल पे भी काम कर रही है और क्योंकि ये फिजिकल लेवल पे सोमैटिक सेंसेशन के लेवल पे भी काम कर रही है, तो देखा ये गया है कि स्ट्रेस बॉडी से रिलीज होना शुरू हो जाता है। लेट अस से कि पहले स्ट्रेस जो था वो 8 आउट ऑफ 10 था या 7 आउट ऑफ 10 था, और टैपिंग के बाद लेट अस से कि 2 पॉइंट्स रिड्यूस हो गया 6 आउट ऑफ 10। तो उसे फिर से रीस्टार्ट करना होता है टैपिंग इन पॉइंट्स पे, इस पॉइंट पे, इस पॉइंट पे, इधर इधर इधर, और फिर से बोलना होता है कि ये जो रिमेनिंग स्ट्रेस है, आई एम लेटिंग इट गो। सो जो रिमेनिंग स्ट्रेस है, आई एम लेटिंग इट गो। सो डॉक्टर रंजन, आर यू एबल टू हियर मी?
यस सर।
ओके। सो इस तरीके से हम पेशेंट को ये ईएफटी सिखाते हैं। So I am again repeating the 5 steps of EFT tapping. Step 1 में हमें आइडेंटिफाई करना होता है वो इश्यू जो हमें बॉदर कर रहा है या वो इमोशन जो हमें बॉदर कर रहा है। स्टेप नंबर 2 में हमें इंटेंसिटी ऑफ द इमोशन यू आर फोकसिंग ऑन राइट नाउ, रेट द इंटेंसिटी। तो इंटेंसिटी को मेजर करना होता है। ये मैं आपको एक एग्जांपल से समझाता हूं तो आपको काफी क्लियर होगा। सो अभी डे बिफोर यस्टरडे की बात है। आई वॉज विजिटेड, मेरे घर में मेहमान आए। ही वॉज अ एमबीबीएस स्टूडेंट, he had completed MBBS, और he was actually giving interview for the post of medical officer in the ESI. So next morning, early morning उसका इंटरव्यू था, but he was feeling stressful. So finding me as a psychiatrist, so he wanted to discuss the issue. So he discussed with me the issue that in 2022 2022 में जब वो फाइनल ईयर एग्जामिनेशंस में था एमबीबीएस की, तो डॉक्टर ने देखा कि एक एग्जाम में जो उनके लिए बहुत टफ था पेडियाट्रिक्स का, तो उस एग्जाम में वो सारी रात, नेक्स्ट डे एग्जाम था बट ही वाज नॉट एबल टू स्लीप द होल नाइट। और एक डर उनके अंदर बैठ गया रात के मिड ऑफ द नाइट कि अगर मैं सोया नहीं तो सुबह मैं फ्रेश नहीं उठूंगा और सुबह मैं परफॉर्म नहीं कर पाऊंगा। सो वन पार्ट ऑफ हिम वांटेड टू स्लीप